Hello friends, we are students of Universidad del Bosque. We are in 7th semester of Industrial Engineering and we are studying the subject of Security Engineering. This group is made of Natalia Castiblanco, Juan Felipe Perez Rojas, Cristian Camilo Sierra, Henry Federico Vargas, Juan David Perez Jaramillo, and Brayan Alejandro Corredor Rodriguez. Welcome to a quick course about first aid in case of burn. Burns become 180,000 deaths per year, in which they occur in low and middle-income countries. In many high-income countries, burn death rates have been declining, and the infant mortality rate is currently more than 7 times higher in low and middle-income countries than in the high-income. Non-fatal burns are one of the main cases of morbidity, which includes prolonged hospitalization, disfigurement, and disability, which usually generates stigmatization and rejection. Burns are among the main causes of the loss of years of life adjust for the disability function in low and middle-income countries.
The cause of a burn are the following: fire, hot liquid or steam, metal, glass or other hot objects, electric flow, radiation such as from radiograph, sunlight and other sources of ultraviolet radiation such as ozone bath, strong chemicals such as acids, bleach, paint or gasoline solvent, and abuse. Now I will talk about the complications. The complications of the or generalized burns can be the following: a bacterial infection which can cause an infection in the bloodstream, the loss of fluids which includes a low blood volume, a dangerously low body temperature, respiratory problems due to the entrance of hot air or smoke, scar or striate areas caused by excess growth or scar tissue, bone and joints problems such as when scar tissue cause churning and tightness of the skin, muscle or tendons.
There are 3 levels of burns. First degree burns affect only the outer layer of the skin. They cause pain, redness, and swelling. Second degree burns affect both the outer layer and underlying layer of the skin. They cause pain, redness, swelling, and blisters. They are also called partial thickness burns. Third degree burns affect the deep layers of the skin. They are also called full thickness burns. They cause whitish, dark or burnt skin. The skin may be numb.
The treatment for burn injuries. As a first step, we have the care of the wound. Antibiotic cream or ointments are administered frequently. If these ointments are administered, it may be necessary to apply them in the diary. This can be a painful process. The doctor can coordinate the change of bandage with the taking of analgesic. In the skin graft, the third degree burns. In the operation, the dead skin is removed and healthy skin is replaced from another part of the body. And finally, the hydration of the wounds. It is important to keep it well hydrated. This reduces the chance of the blistering or the skin tearing. In addition, it reduces itches and may facilitate movements.
To treat a first-degree burn, dermatologists recommend the following tips: First, cool the burn. Immediately immerse the burn in cool tap water or apply cold, wet compresses. Do this for about 10 minutes or until the pain subsides. Second, apply petroleum jelly 2-3 times daily. Do not apply ointments, toothpaste, or butter to the burn, as this may cause an infection. Do not apply topical antibiotics. Second, apply petroleum jelly 2-3 times daily. Do not apply ointments, toothpaste, or butter to the burn, as this may cause an infection. Do not apply topical antibiotics. 5. Protect the area from the sun. When the burn heals, protect the area from the sun by seeking shade, wearing protective clothing, or applying a broad spectrum water-resistant sunscreen with an SPF of 30 or higher. This will help minimize scarring as the redness from burn. For second-degree burns, first, cold burn. Immerse in cold water for 10 or 15 minutes. Use compresses if running water isn't available. Don't apply ice. It can lower body temperature and cause further pain and damage. First, prevent shock. Unless the person has a head, neck, or leg injury, or it could cause discomfort, lay the person flat. Elevate feet about 12 inch. Elevate burn area above heart level, if possible. 4. Finally, see a doctor. The doctor can test burn severity and prescribes antibiotics and pain medication. For third-degree burns, first, call emergency number. Second, protect burn area. Cover loosely with sterile non-stick bandage or for large areas and sheets or other material that won't leave lint in wound.
Hi. Burns are divided into two groups. 1. Minor burns, first degree burns in any part of the body, and second degree burns from less than 2 to 3 inches wide major. 2. Burns occurring 3-degree burns of more than 2 to 3 inches, and second-degree burns to the hands, feet, face, groin, boot, back, on or a major joint. The conclusion is that the burns are not important, not the degree.